name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk again. And action. Hey everyone, it's Dr. Rick. And Selena had a question about breathing exercises to help maybe improve our chances in case we get exposed to COVID. If this is the first time you're finding me, don't forget to hit the subscribe button and the alert button to find out when I do new videos and learn how to control the exhale. So let me explain that. If you watch my video on 478 breath, Andy Weil, a teacher of mine, I filmed him doing this technique, and he made it popular. And it's really easy because you're using a timer. So you've all watched when people practice or learn to play the piano, how they have this metronome that goes like this, and you can get your cadence that way. Well, you don't really need that as you get really good, but if you are a beginner, you watch the thing go back and forth. So you can get your timing down and learn cadence. Well, after a while, piece of cake, but if you, even advanced people, if they can't find their way, they go back to the old metronome. Same thing with the breath. The breath always has to go in and always has to go out. So air goes in when you take a deep breath in, air goes out when you exhale. Now that happens regardless, whether you're sleeping, whether you hold your breath, it'll kick back in, it'll make you want to take your breath out and take it back in again. So there's automatic alarm systems to make sure and ensure that you have oxygen coming in and you have carbon dioxide leaving. So it's a great built-in timer. Now if you link that with 4, 7, and 8 count, this is a picture of Palm Springs. This is back in the 90s, but this is also 4, 7, 8. 4, 7, 8. So it's a count of 4 going in when you allow the breath to come in, a count of 7 to hold your breath gently, and a count of 8 to exhale. Now the count of 4 is inhale rapidly. I like to think of it as inhale, get your shoulders up, push your belly out, get your diaphragm down, get it in. And then the 7 is gently holding that position like a pause. And the 8 is slow. The inhale is fast. The exhale is slow. That's why it's 8. It's double the 4. So I think it's brilliant because it really distracts a lot of patients from the day, the time, the schedule. And then it makes you think of numbers, and it makes you relate the numbers to breath. And then you can actually see the breath going in and out through your mind's eye. So it really distracts. It distracts from all the crap, and it makes you slow down. Kind of like watching a river. I post a lot of babbling brooks and bodies of water on my YouTube video because people just seem to watch it and they get relaxed. Because nature has a way of doing that. Well, this is nature. Now, in this COVID crisis, I think my argument is that we certainly, at this point in time, we know the pathology that's associated with it. We don't know how to intervene yet. I think remdesivir and hydroxychloroquine are frontline tools that seem to be improving the battle. So is social distancing, but I thought that I would throw in my version of a very conservative technique that might help because of what I'll explain in a few seconds. So there is documented evidence as far as what happens in the lungs of the post-mortem lungs of people out of Wuhan. And they found essentially pulmonary edema and lymphocytes that were low, that's the white blood cell counts, and a couple other things, lactate dehydrogenase or LDH. So there are a couple things that were common with people who died. And they also, in the United States and Italy, are finding things that are common in people who are sick before death. Now, the lungs are kind of pneumonia looking on x-ray, but they're not really pneumonia. That's why when you put somebody that's going and crashing within 12 to 24 hours, especially an older person with low reserve, an older person usually has low reserve as far as lung volume. They have low reserve as far as immune system. They have low reserve as far as hormone balancing. So that's why they're the most delicate populations. But you can have death, even younger populations, relatively healthy, supposedly healthy. We don't know everybody's story, but I challenge that by saying if there is a younger person, but they have diabetes, uncontrolled hypertension, elevated cholesterol, excessive depression, obesity, I think those are going to increase your chances, just like you're 70-year-old and above without a disease process. So this virus takes advantage of anybody that's immunocompromised and with low reserve. So as far as the lungs are concerned, and Selena's question, I want to treat this like high altitude pulmonary edema. So I have my video that I just did on the use of acetazolamide and or ginkgo when I went up to 14,000 feet in August of 2019. I was gasping, I was oxygen hungry, because up at high altitude at 14,000 feet, I made it to 14,004 feet just to break 14,000. But man, every step was laborious, and I'm in shape. So I found that I was oxygen hungry because there's less oxygen at that altitude than there is when you're living in Chicago, because there's less pressure up there. If there's less pressure, then the oxygen molecules are more diffuse, and you'll have to take in deeper breaths to make sure you get the same amount of oxygen in per breath than when you're at sea level or at Chicago level. And you can take shallow breaths. You can even be sitting down in the typical teenager posture where you're not even using all of your lung volume, and you're just going like this, and you'll be fine. But if you do that at altitude, you'll pass out. So I was at altitude using my bellows breath, my yogic breath, everything I could, staying hydrated to get whatever little oxygen I could get at that level. So high altitude pulmonary edema occurs when, because of the decreased oxygen, you have something called hypoxia, low oxygen, hypoxia. And you'll find that also in the people that are about to go on a ventilator with COVID, especially if they're going to a COVID crash or a cytokine storm. So what usually happens, at least in the pathophysiology of what happens with high altitude pulmonary edema, is because of decreased oxygen, some blood vessels shut down. And when one blood vessel shuts down, it's like closing the faucet it's like turning on and opening your spigot from the street to full pressure from the street with your pipes, and then shutting down all the faucets after you unload this pressure from the street. You're going to have a leak somewhere. So in high altitude pulmonary edema, when you have no oxygen, smaller blood vessels shut down, but the other blood vessels are backing up, and they're saying, where are we going to go? So they leak into the lung, and they cause pulmonary edema. Now that makes it impossible. You're supposed to have a clean lung, no fluid, and that's the way oxygen transmits in and out of the lung sacs. But if it's all full of water, we're not built for water. That's like drowning. That's like, number one, being low oxygen or hypoxic. Number two, it's like drowning in your own secretions. That's why you're like this. And the frustration is that even if you put somebody on a ventilator, you can push pressure in there, but it doesn't guarantee that you're going to transmit and give them oxygen levels that are sustainable for life. That's why they usually will not have a good outcome off of a ventilator, especially if they're immunocompromised. So, after having said all that, I wanted to show you, I have a couple different videos. I've taken them off my YouTube channel because they weren't popular, on different yogic techniques. I'm a yoga instructor. There are some different yoga techniques for breathing. Ujjayi is noisy breathing. Kapalabhati is, so there's a whole bunch of different techniques, but one of the basic techniques you might be able to follow is to use your abdomen in figuring out how to take a deep breath. So in taking a deep breath in, you want to push your belly out. It's counterintuitive to take a deep breath in. A lot of us, when we take a deep breath in, you can't see my abdomen. When you take a deep breath in, you tend to take your chest out and your belly in. Suck in your belly, just like they teach in the Army. Take a deep breath in, stay on attention, suck in your belly. But actually what you want to do is, when you take a deep breath in, you want to stick out your belly. When you stick out your belly, as your breath comes in, the belly comes out, the diaphragm lowers, and you actually increase the bellows of your chest. So let me take that in step. you want to take a deep breath in, but you also, instead of just bringing the shoulders back, you want to stick your belly out. So it's unusual, but so your shoulders go back, but your belly goes out. And if your belly goes, you don't want to just arch your back. Your belly has to actually, your abdomen has to move forward. If your abdomen moves forward, I used to have this, there's a guy that competed against me in bodybuilding, and he lost, but at the end he was just messing around, and a lot of bodybuilders can make their bellies come out like they're pregnant because they have such good control of the abdomen, and that's what he did. He got a good laugh, but I thought, what is he doing up there? But that is exactly what you want to do with this type of breathing. And why would you want to do that type of breathing? Because you can use every portion of your lung. So your lung is left and right, and there's segments in each of the left and the right lobes. And when you're sitting like a teenager, I hate to say, sorry teenagers, but when you're sitting like this, you can breathe and you can survive, but you're shutting down certain lobes because of your posture. And if you open up, if you try to run like this, you will not get around a track because you're only using up half the volume. And your muscles want and going to demand all the volume. It's called vital capacity. And so if you block off half of your lungs, you will have half performance. Well, you don't want to have half performance during an infection or when you're trying to ascend to 15,000 feet. So we want to learn how to use our full lung capacity in case we come into contact with the virus and we are challenged. We want to have our reserve. We want to have full capacity. So the only way, I wouldn't do it last minute. I think I'd start out now, which is usually what my warriors do. They start out now when times are good, take advantage of when times are good, get a healthy lifestyle so that when times are bad, you're ready. So that is how you take a deep breath in. You inhale, you push the belly out. You exhale, you stick the belly in, and your belly goes in, diaphragm goes up, and all the oxygen comes out. That's the basics of belly breathing, abdominal breathing. And I think that also will give you a little bit more, it'll get you exercise in when you do ascend or when you do come in contact with COVID. This thing is a spirometer or incentive spirometer. I don't have one, but I have this to demonstrate something. So if you've ever seen some guys at a gym, they're wearing a mask, or old school in mixed martial arts, they breathe while exercising, they breathe through a snorkel. Snorkel that you use with the goggles to breathe while you're snorkeling. Well, some trainers would ask their students or their pupils to use the snorkel and breathe through that because you're increasing resistance. Then you're effectively making your muscles of breath work harder so that when you take the snorkel off, piece of cake. Well, incentive spirometry does this. If you've ever been in a hospital and had a bypass or a surgical procedure, while you're in the ICU, they'll make you exercise your lungs. How do you do this? You essentially take this mouthpiece, put it over here, and you go like this. When you inhale, the ball goes up, and you hold it there for as long as you can, and then you let go. And you do that, let go. And you will get very tired after like 5. So going back to what Andy Weil taught the doctors, 4-7-8 breathing, he usually says after like five rounds, you should stop because your patients will get tired. Well, I tell my patients to go 5 minutes. It takes a while to get used to that, but there's no downside. You get dizzy, you're not going to fall down. But I think that the upside is that if you get challenged with this freaking virus, and then you try, while your oxygen starts to go downhill, you try to encourage full breathing and all segments of the lung being used, it's too late. So why not do it now? So this, if you can get an incentive spirometer, you can go to Walgreens and get them online for like $5, or you can make your own. So this is a nebulizer. This is a part of a nebulizer. So those of you who have asthma, you'll hook up the tube to this thing, and the tube will go to the pump, and the pump is where you put the albuterol, and you just sit there like this, and you breathe the steamed up albuterol that's coming out, this vaporized albuterol, and you just breathe it. But if you take this off, there's a restrictive piece here. So what you can do is you can turn it down to the hardest breath, so that's the restriction. It's either no flow or vapor coming through. I close it off and I inhale like I'm doing the incentive spirometer, but through this. And you can actually make it harder by going like this, but just for demonstration. So exhale. I can actually keep my lips on it, but I want you to hear my breath. So I'll try it with lips always on. And you can't see my belly, but I'm sticking my belly out, bringing my shoulders back. And if you wanted to really be challenging, close off like this, take a breath this way. The only problem with this, if there's no incentive because you can't see the blue thing go up. There's a visual with this thing. Oof, I am dizzy. That's nice. There's a blue thing. That's my thrill for the day. Getting too stir crazy with staying home. There's a blue thing that comes up and measured marks, and you can move this slider up and down, and depending on how strong your inhale is and your diaphragm pulls down and your chest goes out, the stronger it is and the more coordinated it is, the higher you will get to as far as breath or vital capacity. So you keep on working on this until eventually you leave the hospital. And you go home with it and you keep on doing it. It really prevents pneumonia in hospitalized patients. But for asthma patients, they might have a problem or a challenge doing that. Asthma typically is a difficulty with getting breath out. But still, I think that a lot of asthmatics do have a problem with also pulling breath in. So I've always been pretty decent with this. This is peak flow. And usually asthmatics will get this thing to a peak flow of like 300 or 400. That's about 450, if you can see the notches there. So when I was younger, I used to be able to take it to the max and hit the top. So I'm going to try to do this now. This is more of an explanation or a demonstration of forced expiratory capacity or forced expiration. So I'll try to do my best. I used to be able to hit that like 10 years ago. And bingo, still got it. So let me try to get to the top. Got to the top. So that's forced. That's 1 second forced expiratory volume. So that says my lungs are really good at contracting, pretty good. I have no obstruction, but this says that I still need work. So, I mean, there's no number, so I can't tell, but I would want to get this to the highest level. If I was going to attack 14,000 feet, which I will, so I might want to buy one of these things so I can see my progress. I'll be hitting 14,000 feet in August, if we're allowed to travel, which I think we will be. And if I start doing this now, I'll be perfect. So I'll give you an update, maybe another video showing you my progress. But so that's essentially working on breath. And there's several different other yogic breaths. They're a little bit confusing. And I'll try to link my videos or put them back online. They're really old and they're really choppy and very poor resolution. That's why I took them off, but I'll see if I can link them. So I talk about Kapalabhati, I talk about alternate nostril breathing, I talk about Ujjayi breathing. I'll load them up for you guys just to learn, but these are the common ones. And if you want to, this is a pretty good book. It was a pretty good book that I bought when I first started my yoga teacher training, and it has different forms of breath exercise, including Ujjayi, Kapalabhati. So that is what I would say would be a non-threatening way to maybe increase your chances of getting through this thing. If you are resolving and you've made it through the infection 2 weeks, but you're still having shortness of breath, I think this is a great exercise to consider doing. If you do have a nebulizer, which you probably do, if you went through the COVID bronchospasm and cough and shortness of breath, you probably got one of these. Don't throw it away. Don't share it, because even if you wash it, it's considered contagious. But use it like I was talking about, not to the point of passing out, but just to the point of working on inhale and strength of diaphragm, strength of abdomen, strength of intercostal muscles, and then get really good at it. And then if you get tired of that, you just want to work on easy stuff, 4-7-8 breath. And I'll link that down below. Otherwise, if you have any questions about what kind of breath exercise you guys follow, or where you've got your spirometer, an incentive spirometer, please put them down below. I'll see you at the next Minute Clinic.